We have had rapid testing at the district level for many years now, and it has been one of the programs that is very, very important as it increases access to rapid testing. So, what we are doing now is to strengthen that program to ensure that we increase access, particularly to people who would not generally go to a facility to access testing, like come down to town and lab or to pay for the test. The tests are free of charge, and we are training our testers now to be better able to practice rapid testing and also to introduce a new test, which is the syphilis testing at the district level. Couple of years we've had a pause on our rapid testing, particularly because many of our testers have migrated or they may have moved on to other positions. So it was important for us to train a new group and to also strengthen the group of testers that we had previous. Our participants include nurses. We also have some medical doctors and some of our staff who work with vulnerable groups and key populations, or most at-risk groups. While the time frame is much shorter, you can do a rapid test and get your results the very same day. You can actually wait for the results because the test is done within 15 minutes. And that I think is very important because it reduces your anxiety at waiting for a test result that will come within 2 weeks. So basically, it is much quicker. Also, the process involves some sort of counseling that gets you prepared for whatever the results might be, and therefore you are better prepared. You meet somebody that would be able to support you with whatever results you have, and you're given the information and guidance with whatever you're going through at the time. You know, there's a school of thought now that HIV doesn't kill, it's cancer that kills. And this is what has driven us to the point where at present, many of our cases, we identify them at the hospital when they are already at AIDS. Our goal is to end AIDS. And if we are trying to end AIDS, we need to identify people before they have any signs and symptoms of it. As you know, HIV is a virus that causes AIDS, but HIV is not AIDS. You are not diagnosed with AIDS. You are diagnosed as being infected with HIV. And if it is caught early, then you are able to get treated and then not develop AIDS. So we do have many clients who would have had diagnosis very early on and be treated and they are living fine. So it seems like it doesn't kill. But however, we do find our clients being diagnosed so late that by the time they are diagnosed, we are unable to do much for them. So what we have been doing is introducing our team to providing compassionate and caring testing services. What helps to ensure that the test results are not compromised and that the test results are reliable and efficient. So our tests are validated prior to being sent to the health districts. And all of our testers, this is one of the first steps, is that we are training the testers to make sure that they are competent. And subsequently, they will receive further evaluations out on the field. So when they go out, they are observed so that they're carrying out the correct procedures. We also do what we call quality assurance tests, where we will send different samples that we can test and make sure that the tests are working. One other thing is that before testing, all testers do what we call a quality control procedure, where you test a few of the test kits to make sure that that batch is correct. And therefore, this ensures that our testing procedures are reliable. All of the testers today would have already been trained in counseling. So they would have known about stigma, discrimination, and how to provide testing and counseling services. So this is just one aspect of it. We do have another aspect where testers are trained to do counseling. So I just want to add that sometimes people think that when they come that their business will be outside, and that's one of the barriers to testing. Your business is not going to be outside, and I have already said to my clients that if you can prove that your business will spill out, you can come in and try to see how we can deal with that, because our aim is to make sure that you will receive the best quality service that is possible. Our staff are picked and they are trained to ensure that they maintain confidentiality. We do emphasize the oath of confidentiality. The more persons that we are able to capture whilst they are well, before they have gotten to the point of AIDS, is the better outcomes we can get with care. And with strengthening of the rapid testing at the district level, we are in fact strengthening the primary healthcare service to respond to the epidemic of HIV and syphilis. I am hoping that we are able to have more integrated services for HIV, that we will increase access to care, access to services, access to testing for both HIV and syphilis, and we will see a reduction in new cases, and particularly in cases that are at an advanced stage. So my goal is to have cases that we can deal with and to reduce the spread. We are working towards the UNAIDS goal of 95, 95, 95, as in 95% of the people who are HIV positive, we know their status, 95% of them would be in care, and 95% will be virally suppressed. When we mean virally suppressed, it means that they are not able to transmit the virus because it has been brought to a level where it is not able to move from one person to the other, or it reduces that chance. So if we're working towards that goal, having these types of programs where we are training testers to go out into the district to identify people early, it is going to assist with that. We should not close our eyes towards the fact that we still have cases of HIV and syphilis. And we have to understand that these diseases are still severe despite the availability of treatment. Therefore, we are encouraging that people do not be afraid of getting tested. Come and get tested so that you can know your status. Once you know your status, you can do what you need to do to keep yourself well. If you're negative, we are happy. We will give you instructions on how to remain negative. If you are positive, we will give you instructions on how you can get treatment. So there's an option despite whatever status you are in. So we're in the process now of revitalizing and revamping our testing sites. This is the first step, and the next step is to start ensuring that at the district level we are able to have testing. Although we are not quite ready for that today, but in the near future we should be able to have testing done in every health district. So within the next few years, I'm hoping that our program is well established. Like I said, it's not anything new. It is a program that has been there for many, many years. However, we have had some challenges, but we are trying now to revitalize the program. So I'm hoping within the next few years, we'll have a vibrant program where we are able to provide testing on a regular basis, and we will be able to keep that momentum